All right, let's get started. Thanks for jumping on, everybody. We're excited you're here. We're going to talk today about some really awesome study results that have to do with what nurses want, specific strategies for retention. It's a huge topic right now, recruiting and retention. We hear it every single day. My name is McKay. Dave is also on the call. He's our expert. I'm just the driver through this fun presentation. We will probably take between 25 and 35 minutes today. We're not going to keep you all day long. We've got a big crowd on today. A couple of housekeeping items. First, if you do have questions, please type those questions in to the little Q&A area or the chat area on the screen. We'd love to address those either as we go or at the end. And the other thing I would say as well is we are recording this, and within a few days of the presentation, we'll send you the recording. Someone from our team will reach out with that recording as well. So with that, why don't we get started? Dave, why don't you introduce yourself, tell us a little bit about what you do, and walk us through that a little bit.
Yeah, absolutely. Thanks for having me, McKay, and I'm excited to be here talking about a really key challenge that a lot of the organizations that we partner with talk about. A little bit about myself. I'm in healthcare tech. I've been in that space for about six plus years. Really excited to be at Incredible Health, helping in a really critical time where hospitals are looking for talent and nurses, and being a part of this marketplace that I believe is very cutting edge and is leading the way to getting nurses, quality nurses into organizations. So I help oversee the West Coast and Mountain Territories, and I work with my team to make sure that we're deploying successful strategies with our partners to make sure that they're adopting some of the best practices in the market as well. So excited to share a little bit about retention today and kind of go from there.
Awesome. Well, thanks for jumping on. We know you're busy. We appreciate you taking the time. Here's the agenda. We're going to talk through the labor market today. We're going to talk through some study results. We'll give you a little bit of insight on Incredible Health, and then Q&A. And the Q&A more properly is probably scattered around through the presentation. So we'll dive actually into Q&A anytime you ask questions when we see them. So let's talk about the labor market today. And Dave, feel free to jump in here anytime you want. But look, we know the statistics, right? 1 in 8 Americans are working in healthcare. It's been the #1 employment sector in the US for quite a while now. We've seen that demand for healthcare and for healthcare workers go up, but the number of workers go down. And this is a problem that's getting worse. We're seeing this across the country. This isn't regional. This isn't a COVID blip in the radar. This is a consistent and persistent problem. Our estimates is by the end of next year, we'll be about 1.1 million nurses short from where we need to be. And that comes from the Bureau of Labor Statistics specifically. We're also seeing almost 20% annual acute care nurse turnover, which is huge. And that has a dramatic impact on everything from financial to patient care. So anything you want to highlight from this slide at all, Dave?
Yeah, I mean, the two things you mentioned, right? One is the turnover. We're seeing turnover be an increasing challenge for the organizations that that are in the market. And the metric that really stands out to me, especially someone relatively new into the hospital hiring and employment space, was the time it takes to hire a permanent nurse. 89 days. Just as someone who's been in tech and in different markets where it usually takes anywhere from 20-ish days to hire talent. To come into an environment where it's on average taking 90 days was a real surprise. And we'll talk a little bit about how Incredible Health solves for this down here shortly. But yeah, that was probably one metric that I really was shocked by when I learned about where the market's at today.
Yeah, it's interesting. Like at a lot of technology companies, you mentioned you've been in tech before. You kind of have to explain to people that there's a problem that you're trying to solve. What I've seen at Incredible Health is no one needs to be told that this is a problem. The nurse shortage is real, right? Like,
yeah,
it's a real significant challenge. Now, you mentioned the national average is around 90 days. I think it's like 89 or 87 days, something like that, in terms of how long it takes to hire a nurse. What we've found is hospitals that are using our technology are able to hire permanent nurses in less than 20 days is the average. That's a substantial decrease from the 89 or 87 day national average. And that's a big deal. And that saves a ton of money, right? We've talked about the savings before. What does that save hospitals and healthcare systems?
It really varies, right? Depending on where an organization comes in. What our customer success team does is we look at each organization independently. We collect data from those organizations to help quantify, what our return on the investment is, that they're making in incredible health. But we've seen organizations, within the first couple of hires made through our platform make back the investment that they're making in our technology and in our team. So, yeah, I mean, this is just an example where technology helps scale and help with unit economics in an environment where it's hard to track that. So,
Great point. All right, let's talk through this study a little bit. This, I think, it's one of the most comprehensive studies that I've seen in this area, in this category. Some parameters around it. So we surveyed 2,500 nurses. So there's a statistical study component and then a survey component. We surveyed 2,500 nurses. We also gathered data from more than 400,000 nurses that are on the Incredible Health platform, and the data was gathered in early 2022.
yeah.
So this is really comprehensive, and we feel like important. It was released at the time, but we've started kind of a series of webinars about these data as well. Anything you want to add about the parameters or how the data was gathered?
Yeah, I think the biggest thing is, so, our platform has north of 600,000 nurses and we're growing pretty quickly, which is super exciting to see. And we really believe in listening to them and to the employers that we work with, right? So this is just one study, but we survey regularly. And what this enables us to do is make sure that we're staying lockstep with the market, the talent side of the market, and our employers. So we're creating value for both sides of our market. And on our customer success side, obviously, we're able to use some of this insight to help drive decisions and change in organizations, to help make sure that the organizations that we partner with are constantly ahead of the curve and offering the best opportunities and solutions to making hires fast.
Love it. All right, let's talk about some of the results of this study. So the first topic, and we're going to kind of divide this up by topic.
Sure.
And then we'll talk about retention, because that's kind of the crux of all of these things is what we'll hit at the end. In addition, when we get to the retention portion, we'll share some best practices and some data. So relocation, nurses are willing to relocate for a job more than ever before. They indicate they're more willing. And they said, the number of nurses who said they would reject a job interview because of relocation dropped 28% from the previous year. So headline, right, is that nurses are more willing to relocate. If the right opportunity is in front of them, they'll move. And that's a pretty big shift year over year. And if you go back even farther, my suspicion is you're going to see even more. That looks like more of a shift, I'm guessing.
Yeah, absolutely. I mean, 20% of candidates today are looking to move states, right? Not just markets, but states. And so, you mentioned opportunities, like anyone's willing to jump for the right opportunity. I think today people are also looking to move closer to family, change their scenery a little bit, be in a different climate, more favorable states. So you're absolutely right. Like, candidates today are excited about the opportunity to relocate, not just for the job opportunity, but for other factors as well. So highlighting that is a key way to attract talent.
Love that. All right, travel nurses. This has a really dramatic impact on permanent nurses. So I just want to dive into what the actual nurses said in terms of the impact travel nursing has on them. So 77% of permanent nurses say they see an increase in travel nurses in their unit during the past year. 32% of nurses in permanent roles said this increase made them feel dissatisfied or extremely dissatisfied. So they're seeing this increase and it's making them feel less job satisfaction. And the primary reason for that satisfaction was the compensation differences between themselves and these travel nurses. My guess is this is something you hear a lot as you talk to our customers and as you talk to nurses.
Yeah, 100%. I mean, when we talk with customers, we still continue to hear that travel nursing is one of the most utilized staffing strategies for health systems, right? And so, while that helps solve one problem, it's starting to create another, which is where, you have a high volume of travel nurses, but the morale of your permanent staff, kind of like you mentioned, starts to erode. Ultimately, I think this is really because permanent staff know that they're doing the same job as their travel counterparts. And their travel counterparts are making 2 to 3 times what those permanent nurses are making. And so that's kind of a recipe for creating dissatisfaction among the floor. And unfortunately, right, like I mentioned earlier, travel nurse still continues to be one of the most utilized strategies. Now we're seeing that shift, especially in today's market where costs are becoming a concern. And we're starting to see more permanent nurses hired. But that's one thing that we definitely look at when we work with new organizations. What is a travel to full-time ratio?
Interesting. And it must be, I think what we're saying with this, or what the data is saying, is that it gets frustrating if you're a permanent nurse and you see travel nurses coming in who have inherently more flexibility with their schedule. And
Yep.
then you add to that, they're higher paid and they're doing the same job you are. That has to be frustrating and grating to those nurses, I would assume. And that's why that's reflected in the survey.
Yeah.
All right. This one is like the first time I saw it was pretty shocking to
Yeah.
me. So 65% of the nurses surveyed said they've been verbally or physically assaulted by a patient or a patient's family member. Not ever, not in their entire life, but within
Yeah.
the last year. Did
Yeah.
this surprise you, or was I the moron who was surprised by it?
No, I was shocked and quite frankly disappointed. We're asking more of our nurses today than I think we ever have, right? And so 65% is staggeringly high. And quite frankly, it's no wonder that we see burnout and turnover rates at such high levels that we're seeing today. I mean, we're a stressed population, and when chronic stress and trauma are present, the likelihood of violence increases. And so I think because of that, nurses are feeling the brunt of that. And ultimately, that's partially where nurses are getting frustrated is, partly how they're being treated. So definitely something that was disappointing to see when I saw that metric at first.
Yeah, that one surprised me and it's disappointing. But I think we've all seen, it's been highly publicized in some cases. We've also seen it on airplanes. We've seen it other places in the last couple of years. All right. So what fuels high turnover? I think we said at the start that around 20% of acute care nurses are leaving. This indicates numbers that are similar and provide more color. 34% of nurses says it's very likely they'll quit their job by the end of the year.
Mhm.
44 said burnout and high stress environment were the most common reasons. Benefits and pay were second.
Mhm.
And then 42% of nurses have started a new role since 21. So the thing that's interesting is if you add that 34 and that 42 up, who have either just left or said they will leave, that's a
Mhm.
really sizable percentage of the workforce. And that can't help but have a negative impact on both the financial situation of hospitals, but also on patient care. Just what jumps out to you in these data points?
Yeah, I mean, I think one thing that's kind of staggering is the increase, right? We've increased the turnover rate by 8.4%. So the national average today being 27%, about 27%, and this is based on end of 2021 data, is pretty high. As we approach the end of the year, we're seeing studies that support, early on that this is probably on its way up again this year. So we're kind of at an inflection point. Like if we as a healthcare industry don't find a way to slow down the turnover, it becomes a quality of care issue for every healthcare consumer in the country, and something that we really need to try to get ahead of and solve for.
Interesting. A couple questions coming in. Why don't we pause just for 1 second and take a couple? So one question, and maybe we don't know the answer to this, but I think we should at least talk about it, is do we know why more people are willing to relocate? What are they looking for in a position that requires relocation? So let me take a stab at that and then you go ahead. I think the thing that the data is telling us is based on these factors, lower stress role, better pay and
Yeah.
benefits. Those are still the factors people are staying and leaving for. They're just now more willing to look elsewhere
Mhm.
in a different state if needed to find those things than they have. So I don't think the reasons are different. They're the same. It's just that they're willing to get a little more creative as they look. Is that fair?
Yeah, I mean, I think there's definitely that, and I think we'll talk a little bit about like what some of the top reasons are. But the number one thing that I've heard from organizations that have been successful in bringing talent in is having really strong cross training opportunities and programs in place, providing nurses with mobility into new specialties, new environments to learn new things. I think that's becoming increasingly common.
Yeah. Yep, great point. Okay, so these are the top reasons nurses say they're leaving jobs. The first is to advance their careers.
Yep.
Second is to get a more flexible schedule or
Mhm.
greater balance. Third is to reduce commute time or to relocate. So they have a
Mhm.
family reason or a personal reason, perhaps they want to relocate,
Mhm.
and then earning higher compensation.
Yeah.
Does the order of this, the things on this list don't surprise me. Does the order surprise you at all?
Yeah, for sure. I mean, I would have assumed, and we hear this from customers a lot, right? Like, we're not in the top 20% tile in compensation. So we have an uphill battle. Whereas the data suggests that's probably not, it's one of the factors why someone's looking to make a change, but it's not the only factor. And I think the top two things here are solvable things in most organizations. Advancing careers for nurses is huge, and getting creative with scheduling and more balanced providing programs for nurses are things that we've seen really successful in organizations we partner with. So it's cool to see this data because it helps really contextualize where compensation falls in list of priority. And while that's always going to be a factor, right, it's not necessarily the leading factor. So that's really what I think stood out for me here.
Yep, agreed. All right, so these are retention strategies. These are not necessarily based on the study. They're based off of a lot of discussions that we've had with CNOs from around the country on webinars, as well as customers. Let's go through these. So in terms of retention strategies, career mobility planning, what do you want to talk through on this one? This one is a really interesting, I assume this means the ability to advance in their career by
Yeah.
staying at the same place.
Yeah, I mean, really, it's just going back to the basics here. What nurses are really looking for here is they want someone to come alongside them, understand what their goals are, and help them ultimately get the experience and the education that they need. So again, I mentioned cross training as an example of this. That's a very common strategy that a lot of organizations deploy to help with career mobility planning.
Yeah, that can be facilitated by leadership. It can be also something that nurses, insist upon. We've seen it started in multiple ways within organizations.
Yeah.
Greater flexibility. This one, I believe, just refers to the ability to have different experiences at work, but also different hours, different structure of who works nights and weekends. And that is, something that I think the younger workforce is demanding as well.
Yeah.
Anything you want to highlight on number two there?
Yeah, I mean, examples of this are offering internal travel pools, multiple shift options, float pools, et cetera. I mean, there's the way that we look at this is just allowing for flexibility in how organizations cover a floor. And ultimately, that's something that, kind of like you mentioned, folks in today's market are looking for.
Great. Strong relocation packages. We've talked about relocation a lot. This one is a big deal. Get people to move to you and not away from you.
Yeah.
Is kind of the key here. Anything you want to highlight on three?
Yeah, I mean, I think ultimately just strong relocation packages, like we mentioned, right? Candidates are willing to make the change. I think, having openness for out-of-state talent, housing benefits for relocators, they make a huge difference in helping sway a candidate to take that opportunity.
Pay is pretty obvious. Any specific guidance you have on whether it's compensation structure or pay amount increase? Like, what are the things you would highlight here?
Yeah, there's ways to get creative here. I mean, the baseline that we think is almost necessary in order to be competitive in today's market is to be above the 50th percentile at baseline. And then on top of that, offering competitive shift differentials for nights and weekends. These are ways to get creative with pay. If the baseline of your compensation may not be in the top 10, 15, 20%. We find that differentials is a really competitive way of making making your package competitive.
And then constant communication. We've done some webinars recently with CNOs who are convinced that this improves their retention dramatically. So just the ability to consistently and constantly communicate with the nurses, get their feedback on what they like, what they don't. This can be via surveys that you send to them. This can be via groups, leadership groups within the nurses that are constantly communicating with the CNOs. This communication seems to drive higher retention for these hospitals that really focus on it. Any other tactics you want to highlight on number 5 there?
Yeah, I mean, you hit the nail on the head, right? Like, I think it's really important to listen to what the team is saying and feeling, and we hear this a lot too. Organizations that I've seen do this really successfully is everyone top down, right? Leadership all the way down is engaged with the floor, and they're getting feedback, and then they're implementing those changes, and that ultimately ends up becoming a talking point when talking with candidates as well. And when candidates see that in action through the interview process, that can be a very compelling reason for someone to make a change as well.
That's great. All right, awesome. So let's conclude here. We said we'd be between 25 and 30-ish minutes. So let's talk about how Incredible Health can help here. So we're used by over now 600 health systems and hospitals. We help you hire permanent nurses in under 20 days, but we're not a staffing agency. You can see some of our customers here on the screen. Essentially, nurses join Incredible Health for the free tools that they can see on the platform, as well as the ability to connect with hospitals. So they join the platform, they're looking for permanent work, not travel work. And then we essentially connect the employers and the candidates. So the employers basically apply to the candidates instead of the other way around. So nurses love that. And then talk about the screening, the algorithm, and the data analytics that are a part of this, because it's pretty intensive in terms of how we match.
Yeah, 100%. So I think, once we have those relationships with our employers and we've built those strong relationships with nurses who have been screened, the marketplace does the rest, right? And so nurses love signing up for Incredible Health and having access to multiple employers who are looking for, what they have. And ultimately the technology does a lot of the work for us. And so it's really exciting to see. I mentioned this earlier, but being able to do this at scale really allows us to be really different than an agency. We're really not an agency. We are an algorithm, and the technology is one component of it. I think for me, the exciting piece is the partnership and the relationships that we build on both sides of the marketplace help enable this to be successful.
Love that. This is so I'll let you highlight this slide, because there's a lot of things that are important here: cost savings, time saved, all sorts of things.
Yep. Yeah, I mean, speed is ultimately the superpower here. We stress this with our current organizations. And ultimately our CSMs are consultants. And so while the marketplace is introducing you to nurses from across the country, we're working alongside leadership at our systems to help optimize practices, both for the throughput and for speed. So you get every advantage that you can have to win nursing talent in this competitive landscape. So our team does a really good job finding strategies, best practices, and tactics to help make sure that you can be the first offer, because we know, based on our surveying and the data, that 68% of candidates are going to accept their first offer. And 61% of candidates accept their first offer, even when the second or third offer has higher compensation. So I feel like those two data points really, if me saying speed is a superpower wasn't enough, those two data points should do it. And as partners with our organizations, we really try to emphasize and drive this home.
Love that. This is kind of what we've highlighted already. Just talks about the speed to hire. You can see the speed that companies see when they, or hospitals and systems use when they use Incredible Health. Yeah. And then the retention is actually higher. So some people, I think, may be concerned, well, gosh, you hire so quickly, does that hurt retention? It's actually the opposite, which is great.
Yeah, I mean, you're absolutely right, right? Like we focus on retention. It's just as important as getting a nurse, if not more important, right? And we do know that experienced nurses end up staying longer at organizations, and so the average experience of nurses on our marketplace today is 8 to 10 years. And so when you hire an experienced nurse, you're not only saving today, but you're saving down the road because we know that they're going to contribute the least to turnover. In fact, if you go back to the previous slide, not only is that going to help contribute, but so is this the speed and the pace, right? And so we really look forward to working with our partners to make sure that we're hiring quickly to ultimately save the organization money as well.
Awesome. All right, we've got a few questions that we haven't hit, so let's address those.
Sure.
And we're not guaranteeing we'll know the answers to all of them, but we'll ask them. Can you give us any range or any how people should think about relocation dollars being offered?
Yeah.
Like, where should hospitals start there, whether it's a dollar amount or just some methodology to think through it?
Yeah, this varies by organization, right? And I think the guiding principles that I've seen is twofold. One is organizations that are super competitive on relocation tend to offer, $10,000 to $20,000 in relocation assistance, up to, depending on specialty. I've seen organizations look at criteria like how far is a candidate moving, look at the needs of the specialty that they're trying to hire for. Ultimately, what I've found and what I hear from organizations is relocation bonuses and benefits, while they seem expensive upfront, and they are, tend to be a much cheaper alternative to hiring a travel or an overtime nurse. So ranges definitely vary. It varies on market. And we have data that supports mobility as well. So we can help answer that question with a little bit more information when we know, kind of which market you're in, and we can give you some more context there.
Great. Shirley asks, can you talk a little bit more about the pay being above the 50th percentile? Like,
Yeah.
is that why is that the magic number?
Yeah, I mean, I think that's based on the partners that we work with. We have data that shows, what the pay ranges are in given markets. Ultimately, we find that organizations that are north of that 50th percentile have a better, what we call, conversion rate. So this is the rate of candidates that we present to you that accept an interview request that ultimately get hired. The magicness of it, I'm not too sure, but what I do know is organizations that are at least at that level tend to have a better conversion rate than organizations that don't. And those that don't, again, can make up for that in other ways, right? Relocation bonuses, sign-on bonuses, differential increases, et cetera.
That's great. Good stuff. Well, thanks for jumping on. If you're interested in learning more, in the chat there, our friend Danny has posted the ability to request a demo. We'd love to work with you, see if it's a fit for you. It's a pretty quick phone call with a member of our team who can do a demo of the platform and see if it would work for you and your organization. And then you could also email us at the email address on the screen. So any final thoughts here before we conclude?
No, this has been super, super exciting. I saw some other questions in here too that we answered around relocation. But yeah, if anyone has any other questions, feel free to reach out. We'd be happy to help.
Awesome. Well, thanks again for jumping on, and thank you for taking the time, everybody. We hope this was valuable. We're getting some good feedback already, which is great. So thanks again, everyone. Have a fantastic day and a great rest of the week.
Take care.